Welcome to the 21st Century Man podcast. We're kicking off quite a fascinating exploration today.
We are.
We're diving deep into chapter 26 of the book, The 21st Century Man, and the chapter is titled Stronger Bones.
Yeah, this one's by Dr. Judson Brandeis, who's a urologist, and it really tackles a foundational aspect of men's health.
Something we don't always think about, perhaps.
Exactly. It's often not top of mind until, something goes wrong. It's all about building that resilience from the inside out.
The chapter kicks off with a quote, actually, from Ronald Reagan. It really makes you pause.
Which one is that?
Many a man has failed because he had a wishbone where his backbone should have been. It sets a strong tone, doesn't it?
It really does. It immediately pushes you beyond just like physical structure to thinking about inner strength too. Metaphorical backbone.
But also the literal backbone.
Yeah.
And, while we often hear about bone health, mainly regarding women, this chapter makes it crystal clear it's absolutely vital for men, too.
Absolutely. Especially as men age, we're going to unpack why strong bones are so crucial and maybe debunk a few common misconceptions along the way.
Good. And we'll break down some of those key terms you hear, like osteoporosis and osteopenia.
Right. Explain what they actually mean for you, the listener, in simple terms.
Yeah, make it understandable. Our mission today, really, is to pull out the absolute core insights from this chapter.
And the actionable steps, what can you actually do to build and maintain strong bones?
Exactly. Think of this as your roadmap to laying that solid foundation for a healthier future. Sound good?
Sounds great. Let's get into it.
Okay, so diving in, the chapter really emphasizes right away why men need to prioritize bone health. It's not just a secondary concern.
Not at all. I mean, yes, osteoporosis gets diagnosed more in women, but it's a significant health risk for men, too. It leads to considerable morbidity and even mortality.
And there's that interesting point about age, right?
Yeah, what's quite striking is that after about age 65 or 70, men and women actually start losing bone mass at pretty similar rates.
I wouldn't have guessed that. I always thought the gap remained wider.
Nope, it converges. And the numbers really tell the story. In the U.S. alone, we're looking at around 2 million men over 65 with osteoporosis.
Wow.
And another 3.5 million with osteopenia. So it's much more prevalent in men than many people realize.
Okay, so let's clarify those terms for everyone listening. Osteoporosis versus osteopenia. What's the core difference?
Okay, so osteoporosis is the more severe condition. Your bones have lost significant density. They become porous, very fragile. This dramatically increases your risk of fractures, even from a simple bump or a minor fall.
Right.
Osteopenia is like the stage before that. It means your bone density is lower than normal, but it hasn't crossed the threshold into osteoporosis yet.
But still a risk factor.
Oh, definitely. Having osteopenia still puts you at a higher risk of breaking a bone compared to someone with totally normal bone density. It's a warning sign.
And something I found really interesting in the chapter, maybe a bit concerning, is that for about half the men diagnosed with osteoporosis, the cause is unknown.
Yeah, that's a really key point. In roughly 50% of cases, doctors can't pinpoint a specific secondary cause.
Which suggests?
Well, it strongly suggests there might be a significant genetic component at play for men's bone health, maybe more than we previously thought. Needs more research for sure.
Okay. The chapter then kind of walks us through the timeline, how men's bones develop, and then the natural loss over time. Talks about peak bone density.
Right. So men typically hit their peak bone mineral density around age 20. This surge is largely thanks to, testosterone during puberty.
So puberty is key for building that bone bank.
Absolutely. You're basically making your biggest deposit into your bone bank account then. Build it strong early on.
Because after that peak,
It's a gradual decline. Over a lifetime, men typically lose somewhere between 20% to 30% of that peak bone mass they achieved.
that sounds like quite a bit.
It is. But what's also fascinating, and the chapter highlights this, is that our bones are constantly remodeling. Your adult skeleton is largely replaced, recycled if you like, every 10 years or so.
So bone health isn't static. It's an ongoing process.
Exactly. It's dynamic. You've got to keep supporting it throughout life.
So lower bone mass later in life could be because you didn't build enough peak mass when young, or because you lost it too quickly later on.
Precisely. It could be one or both. And the stats the chapter gives are pretty stark. A 60-year-old man has a 25% lifetime risk of an osteoporotic fracture.
1 in 4.
Yep. And by age 90, it's estimated that 1 in 6 men will experience a hip fracture. That's a life-altering event.
Definitely puts things into perspective. It makes understanding the risks even more important. So what does the chapter say are the primary risk factors for men?
Okay, so primary risks include a family history of osteoporosis.
Yeah.
There's that genetic link again.
Right.
Also, poor bone growth during childhood and adolescence didn't
Uh-huh.
build up that peak mass we talked about.
Makes sense. Nutrition and activity then.
Absolutely. And then the big one often discussed is low hormone levels.
And for men, that primarily means testosterone, but also estrogen, surprisingly.
Exactly. Low testosterone is described as probably the most clearly defined hormonal risk factor for osteoporosis in men. Research shows bone loss speeds up when serum testosterone consistently drops below around 200 nanograms per deciliter.
That's a specific number to keep in mind. Did the chapter mention studies on testosterone supplementation?
It did. It referenced a key study with older men who had low testosterone. Giving them testosterone supplementation for a year showed significant improvements
In what specifically?
in their bone density and also in estimated bone strength, especially, interestingly, in the spine.
So it suggests a direct link that supplementing can help if levels are low.
For some men, yes, it can directly impact skeletal health positively. The benefits highlighted were things like improved bone mineral density, slowing down that bone loss rate,
And fewer fractures?
and crucially, yes, a reduced risk of fragility fractures those breaks from minimal impact.
Which leads to a pretty clear recommendation in the book.
Right. The chapter strongly recommends that men consider getting their total testosterone levels checked via a blood test after age 50.
Okay, that's straightforward advice. But you mentioned estrogen too. How does that fit in for men?
Yeah, it's not just testosterone. Estrogen, specifically estradiol, is actually vital for bone metabolism in both men and women. It helps preserve bone density.
Really? I always associate estrogen primarily with women's health.
It plays a key role for men, too. Research suggests that when men's estradiol levels drop too low, the chapter mentions below about 15 picograms per milliliter, it's linked to poorer bone health. So it's a hormonal balance thing.
Fascinating. Okay, so those are primary factors. But the chapter also covers secondary causes. What falls into that category?
Right, secondary causes are more about external influences or other health issues. Think nutrient deficiencies, lifestyle factors, certain diseases, even medications.
Let's start with nutrients. Vitamin D comes up a lot in health discussions. How about here?
Big time. Vitamin D deficiency is strongly linked to osteoporosis, but also to reduced physical performance and a higher fracture risk. You need vitamin D to absorb calcium effectively.
And calcium itself is obviously key.
Fundamentally, if your diet's low in calcium consistently, your body might start pulling it from your bones, weakening them over time.
The chapter also mentioned something I hadn't really connected before, stomach acid.
Yeah, that's an interesting one. You actually need healthy levels of stomach acid to properly break down minerals from your food, including calcium. So if you have chronically low stomach acid, maybe from certain medications or conditions, your mineral absorption could be impaired.
Affecting your bones indirectly. What about gut diseases?
Yes, conditions like celiac disease are mentioned. They can damage the lining of the gut where nutrients are absorbed.
Leading to malabsorption of calcium, vitamin D.
Exactly. Plus, the chronic inflammation often associated with these diseases can also negatively impact bone metabolism.
Okay, moving to lifestyle. Smoking and alcohol, probably bad news for bones too.
No surprise there, unfortunately. Both cigarette smoking and excessive alcohol intake are consistently shown to increase bone loss and fracture risk.
And physical activity,
Yeah,
or the lack of it.
a huge factor. Being sedentary significantly increases your risk, particularly for hip fractures. The chapter notes it can even double the risk.
Wow.
And even just being immobilized for a period, say after an injury or illness, can lead to noticeable bone loss. Use it or lose it definitely applies here.
It really does. What about other diseases or medications? That sounds like a broad area.
It is. Chronic conditions affecting the kidneys, lungs, stomach, intestines, or hormone levels can all play a role. And then there are medications.
Like steroids.
Steroids like prednisone are a major one, known to cause bone loss, especially with long-term use. Also, some immune suppressive drugs, certain seizure medications.
And the chapter specifically calls out one treatment used in men's health.
Yes, androgen deprivation therapy, or ADT, used for prostate cancer. Because it dramatically lowers testosterone, it causes rapid bone loss. That needs careful management.
But there was a positive note about a common medication, finasteride.
That's right. Good clarification in the chapter. It explicitly states that finasteride, used for prostate shrinkage and hair loss, does not appear to cause bone loss based on current evidence. That's reassuring for many men.
Okay, so knowing the risks is one thing. What about testing and taking action? When should men get tested? Routine screening isn't recommended for everyone, right?
Correct. Routine DXA scans aren't for all men. But the chapter recommends testing for men who have specific indicators.
Such as?
Things like clinical signs of low bone mass, maybe seen incidentally on an X-ray,
Yeah.
or a history of low trauma fractures breaking a bone too easily.
Height loss too.
Yes, a documented height loss of over 1.5 inches is another flag, and also men with known significant risk factors.
Like the ones we discussed. Long-term steroid use, ADT, low testosterone.
Exactly. Also, conditions like primary hyperparathyroidism or intestinal disorders affecting absorption. For those groups, a DXA scan of the spine and hip is recommended.
And DXA is the gold standard for measuring density in those key areas.
Yes, dual energy X-ray absorptiometry gives an accurate picture of bone density in the spine and hip, which are critical areas prone to debilitating fractures.
So, beyond testing, what are the cornerstone lifestyle actions men can take?
Exercise is paramount, specifically weight-bearing exercises, things where you're working against gravity.
Walking, jogging?
Walking, jogging, dancing, climbing stairs, using a Stairmaster or treadmill. Even non-contact sports like tennis or soccer help.
What about weights?
Definitely. Weight training, resistance machines, these directly stimulate bone building by putting productive stress on the skeleton.
So, stressing the bones in a good way is key. What about specific supplements or therapies?
Testosterone replacement therapy comes up again, specifically beneficial if levels are confirmed low, below that 200 mark usually.
And calcium and vitamin D.
Yes, specific intake recommendations are given. For calcium, it's 1,000 milligrams a day up to age 70, then bumping up to 1,200 milligrams after 70. Supplements can help if diet isn't enough or levels are low.
And vitamin D.
The guideline is 600 IU daily up to age 70 and 800 IU for 71 and older. But, and this is important, the chapter stresses getting your levels tested.
Why the emphasis on testing D levels?
Because individual needs vary hugely based on sunlight exposure, sunscreen use, skin type, location. A blood test tells you where you actually stand.
That's the point. Any other nutrients mentioned?
Vitamin K gets a nod, as it works alongside vitamin D for bone health. And magnesium is also supportive. Magnesium citrate is mentioned as a well-absorbed form.
Okay, what if bone loss is more severe, like from steroids or ADT?
Then more aggressive treatment strategies are needed, working closely with the doctor. It also emphasizes treating any underlying conditions like celiac disease or low stomach acid to fix absorption issues.
And the basics still apply.
Absolutely. Avoid smoking, limit excessive alcohol. Those are foundational.
And if lifestyle and supplements aren't enough, are there prescription options?
Yes, for men who don't respond enough to conservative measures, oral bisphosphonates drugs like alendronate or risdronate are mentioned as effective and often inexpensive first-line prescription options.
Are there other types?
Yes, intravenous versions are also available if the oral ones aren't suitable. But the key message is, these require proper medical supervision. You need to be monitored by your physician.
You know, this chapter does a fantastic job of taking a complex topic and making it really clear and understandable.
It really does. Dr. Brandeis presents the science, but also distills it into practical, actionable advice. It feels very empowering.
That's a good word for it. It empowers you to actually do something about your bone health.
And that's representative of the whole book, really. The 21st century man is packed with this kind of valuable, accessible information across all aspects of men's health.
Totally agree. We really encourage listeners, if you haven't already, pick up a copy, read the whole thing. This deep dive into bones is just one piece of a much larger, very valuable picture.
Taking that time to understand your body, including your bones, is such a crucial investment in your long-term health and, frankly, your quality of life down the road.
Well said. So just to quickly recap our deep dive on Chapter 26, Stronger Bones.
Maintaining strong bones isn't a passive thing. It's an active, ongoing process for every man.
Right. Understanding your risks, making those healthy lifestyle choices, especially weight-bearing exercise, and being aware of potential underlying issues or medication effects.
All of that can significantly impact your future health.
We really encourage you to think about this information. Maybe means talking to your doctor about testosterone or vitamin D levels, particularly if you're over 50.
Or maybe it's just committing to adding more walks or some resistance training into your week. Small changes add up.
And again, the chapter itself in the 21st Century Man goes into even more detail. Highly recommend checking it out.
Definitely. Well, thank you for joining us for this deep dive into Stronger Bones.
It's been insightful. Next time on the 21st Century Man podcast, we'll be shifting focus slightly lower. Chapter 27 is all about foot health.
Ah, the unsung heroes. Looking forward to that.
Me too. We hope you'll join us then.